Hi guys, so this is my sixth vlog for Informatics 645 at Mercer University. And this vlog we're talking about electronic health records and some of the risks associated with them and how we can find solutions to some of those problems. So electronic health records have become a vital part of healthcare, and they are mostly beneficial to healthcare organizations, but we still have to consider that there can be some risk, as with any form of technology, associated with them. So, according to the University of Kansas Medical Center, here these are some risks that can be associated with electronic health records. And one of them is unauthorized access to patient data. So that is basically someone who is not authorized to have the patient data or is not on the patient's care team getting a hold to the data and getting into the wrong hands. Um, it's a lot easier to do this with electronic records because they're easily accessible, like on a computer. Whereas with paper records, you have to literally go find the person's record in a file cabinet, so they're a lot easier accessible. But a solution to this would be to make sure that the information is kept safe on a computer, like password protected or encrypted, so that it couldn't be hacked. And make sure that if you're charting on a patient, you don't leave your password up or leave the chart up where anybody can walk by and see it. Make sure you close everything down when you walk away from the computer. Another risk associated with EHRs is inaccurate patient information if not charted in real time. So this could be an example of like us working in like emergency situations, if we're in a cold or if we had to give a stat treatment or stat med. You may not in your mind think you're able to chart right then and there. So you may say, well, I'll give the med, I'll do the treatment, and I'll go back and chart later. But if you forget to write the information down, you could be in a write it down wrong. So when you get back to chart, the information could be put in the computer wrong, could be a wrong heart rate, wrong respiratory rate, just anything that you chart. If you're not charting it while you're standing there in the patient's room giving the med, could also be a risk. And with that risk, we could make sure to educate the staff on the importance of real-time charting, because with the paper charts, a lot of times you would have to actually take paper in the room and write down everything you're doing, write down all the meds you're giving. But so it's easy to forget to chart when you're in a hectic situation, when you're on a computer, because you know you can always go back, pull up the chart, and chart all the information. But it's important to do it while you're actually in the room with the patient. Another risk would be unavailability of records during downtime. So with any kind of technology that needs to be updated, so it's the same with electronic health records and their systems. So a lot of times they have downtime. I know at my hospital is some mornings out the week from like 3 to 4 they'll have downtime just to update the system. And during that downtime, you can't access the actual record. So if you want to give a med, you can't scan the patient to give the med. The only thing you can do is open like a read-only form, and you can go in and look at the information that way. But you can't actually chart on the patient or write down anything that you do to the patient. So that could be a risk, because if you need to give an emergency med, there's no way to chart that you gave that med. If you need to access the patient's allergies or anything like that, there's no way to access it while the system is down. And so a solution for that would be to have backup plans for documenting or backup information if that was to happen. So at my hospital, when we do have those downtimes, we have sheets that we have to write and chart everything on. And then once the downtime is over, we go back and transfer the data from the paperwork that we filled out to the patient's record and to their chart on the computer. And then file that actual downtime sheet somewhere in the department, so if anything comes up, we'll have it there and it'll be easily accessible, so they'll know that during the downtime we were giving meds like we were supposed to. It's just that the system was down and we did record everything. We just went back later and added it to the electronic record.